lactic acid with a normal level of 0.3 to 2.6 is a lab that is drawn often when we may suspect that a patient may be septic. So if a patient comes in with a temp of 100.2, their blood pressure is liable, or their blood pressure is 70/30, and they're not very responsive, we might suspect that the patient may have sepsis. So what we'll do in that instance is we'll run a lactic acid level. So like I said, our normal level is 0.3 to 2.6. And the main indication for this is really what we're doing is we're evaluating tissue oxygenation. We're trying to figure out, are our tissues able to get the oxygen they need to carry out metabolism and to get energy. So really lactate or lactic acid is a byproduct of anaerobic metabolism. Okay, anaerobic metabolism means it's metabolism without oxygen. Okay, where normally what our cells do is they use aerobic metabolism to break down glucose for energy. So normally the cells have oxygen available, and that oxygen is used to break glucose down and produce ATP. But what can occur if our body doesn't have the oxygen that it needs is it converts to anaerobic metabolism. And the byproduct of that is lactic acid. And as that acid builds up, our body becomes more acidic, our pH drops, and we become very acidic. And so really that's the byproduct of that. And so what we're really doing is we're investigating, why is the patient acidic, number one, and then we're also investigating, okay, is the patient using anaerobic metabolism to try to create energy? And is that why they're getting all this buildup of lactic acid? So really what we're trying to find out is there oxygen available, and are the tissues able to use the oxygen as they need to in order to carry out metabolism? And that's really what we're looking for here. And that can happen a lot in sepsis, where the body will switch to an anaerobic state. So some of the conditions that would cause an elevated lactic acid level would be shock, sepsis, like I just said, tissue ischemia, the tissues aren't able to use oxygen, or the tissues aren't getting oxygen, carbon monoxide poisoning, lactic acidosis, diabetes mellitus, especially if we go into DKA or diabetic ketoacidosis, heart failure, pulmonary edema, strenuous activity. And what would cause decreased levels? Well, honestly, we're not really looking at decreased levels of lactic acid. What we're really concerned about is our lactic acid getting up too high? Okay, so we can have elevated lactic acid levels as we work out. We can produce some lactic acid, but what we're really concerned about here with these patients are these shock patients, or these septic patients, or these patients with severe ischemia, or like our DKA patient, where they're not able to use energy, or they're not able to produce energy as they need to. Okay, so they switch to this anaerobic metabolism phase, and they don't have the oxygen they need to produce energy and to carry out metabolic processes in the body. All right, so that's lactic acid. When you think lactic acid, what I want your mind to automatically do is I want your mind to think of oxygen and metabolism and how much we need oxygen to survive. And that's where your mind really needs to go, is over to oxygen. And what happens if we don't have oxygen? It's not good. And that's going to cause a buildup of lactic acid.
Thank you for listening to our podcast today. Nursing.com is the trusted learning hub of all future nurses, your secret weapon for passing nursing school with your sanity intact. We want to invite all our listeners to visit us online and take advantage of a special promo offer. Just head over to nursing.com/free. That's nursing.com/FREE, and check out the free resources and other goodies that we have there just for our podcast listeners. Until next time, go out and be your best self today. And as always, happy nursing.